If it's lit and it's green, it's working.
Now
It was on before. Do you hear me?
No.
Did Ryan leave?
Okay, I'd like to call the Regional EMS Council, New York City meeting of February 17, 2024 to order.
If it's lit and it's green,
Is the approval of the January 30th meeting, which were distributed. Everyone's had a chance to read them. Are there any comments, corrections? Motion to approve is in order. Second.
Aye.
All in favor?
Aye.
It's approved. I forgot something. Roll call.
When I call your name, please say present. Jason Zimmerman or Joshua Hartman. Chief Grace Cacciola. Here. Chief John Nevins. Bradley Kaufman. Andrew Dahl.
Present.
Allison Burke. William Goffin.
Present.
Dominic Bettinelli.
Present.
Daniel Mizels.
Present.
Barry Gussman. Robert Bristol.
Present.
Mordecai Goldfeder. Travis Kessel or James Downey.
Present.
Jerry Gelbard.
Present.
David Nicopanski.
Present.
Joseph Schenker.
here,
Who's the whole?
just stepped out.
David Ellie. Michael Rayola.
Present.
Michael Vatch. Or Mordecai Lax. Martina Baccarella. Vincent Barranco.
Present.
Nancy Benedetto.
Present.
Arthur Cooper.
Present.
Robert Krupe.
Present.
Megan Kessel. Manfred Fuchs. Sean Graves. Jerry Gombo.
Present.
Eugenia Langsam.
Present.
Brian Levinsky.
Present.
Dennis Laurie.
Present.
Mitchell Powell. We have a quorum.
Thank you. Okay, I'm going to now read the correspondence, an abbreviated report, the correspondence report. The whole report will be distributed with the minutes. Ambulance operating certificate to receive from Flushing Community Volunteer Ambulance Corps, Citywide Mobile Response, and GMR Event Services LLC, and LLC DBA Crowd Audit. Okay, the following New York State Department of Health Enforcement Actions. Leah Cosino, Staten Island, New York, number 361718, suspended for 1 year effective 1/11/24. In violations of a whole bunch of legal stuff. The suspension is stayed, placed on probation for 3 years effective 1/11/24, and assessed a civil penalty of $2,000. Stephanie Lugo, Bronx, New York, 361718, is revoked effective 8/17/22, violations of other legal stuff. Stanford Fire Company #1 Incorporated, Stanfordville, New York, 1330, is surrendered effective 1/9/24, violations of all legal stuff. Enforcement actions for both revised agents reviewed on the New York State side. Ambulance agencies, EMS lead photos, logos, and videos were received from Ambulance National, by some community, ambulance service, Rockaway County Fire Department, Montefiore EMS, and Monticello. And the office encourages you to please send them in as soon as you can. CFR EMT and paramedic original renewal course application received from emergency care programs to the EMS, VNH, Emergency Medical Training Incorporated, and the Center for Allied Health Education. All applications appear complete for documentation purposes, and we need to vote on these. Is there any discussion? I'll make the motion to approve all those correspondence that I read.
Motion to accept.
Do all the renewals.
Aye.
Any further discussion? All in favor, say aye.
Aye.
Any opposed? Any abstentions? Please mark it as unanimous. Thank you. Good. The office of the council sent out agendas, minutes, associated attachments for the meeting. The attachments that included, and you should have seen all these. Budget, Information about the task force. Article 30 showing proposed changes. EMS training budget information. Onion budget testimony, and New York State VARA legislative review. I assume that you all read these things in great detail because you asked such good questions in our discussion. Marie Diglio sent a letter to Dr. James V. McDonald, Commissioner of the New York Department of Health, urging the Department of Health to award Jamaica Hospital Medical Center with critical capital funding from the statewide healthcare facility transformation program to support the development of comprehensive cancer care services. Any questions about the board? Okay. Next. Staff report, emergency preparedness update, Scott.
Yes, the third and the final round of the FEMA reimbursement for COVID mutual aid response has been received. We will be sending out the checks shortly. And the report.
Any questions? What type of reports up on? Okay. Program agency update, Marie.
This is also short. We sent in our vouchers about a month ago. Well, actually in January, we just got paid. So the state is sending us our money fairly quickly. I and other program agency directors are going to be meeting to discuss the Article 30 changes. And how we are going to proceed with items that we don't think are working for our regions. We're specifically interested in going after money. Right now, the state budget that is proposed gives the State Department of Health, Bureau of EMS, about $15 million. And our program agencies got zilch. So we are going to try and make a case to the chairs of the health committees on the Senate and Assembly side. We're not going to directly ask them for money because we don't need to be accused of lobbying, but we are going to ask them, you know, this is what you're proposing, and maybe you'd want to give a little more money to the agencies that actually are the boots on the ground, and not hire another, 300 administrators. So, and that's what we're doing. And I'd like to have
We write a letter.
yeah, we're definitely going to write a letter. And, yes.
Not the agency.
oh yeah, yeah.
So
We're going to be sending out templates, letter templates, so that every person here is allowed to send letters to their legislators and not be accused of lobbying. If you work for an ambulance agency, share it with people. Our legislators respond to piles of letters. Sounds stupid, but when they start seeing the letters pile up on their desks, they respond because they know their constituents are actually, interested in something. So we'll do a template letter. I'm waiting to work with program agencies. I also would like to have one or two people from this committee to work with me on the Article 30, because this should not be coming just from me on staff. I'd like, someone from the hospital sector, someone from the volunteer sector, and maybe, I know fire's working on it. We'll certainly welcome someone from fire, so that everybody has a say in what's going on. I think a lot of the changes are great. They're not all bad. I'm not so hot on the, the EMS sector things. So we got Nancy, and we have this guy over here who's quiet and tired.
anybody else?
Okay. Oh, Frank, okay. Frank is the program agency director for the fire department. Okay,
Thank you. Anything else?
thank you. No, isn't that enough? That's horrible.
That's enough.
Thank you.
There is no ambulance committee report. We're going for next month. Training education committee report.
Training and Ed meeting was rescheduled for this Friday. On our agenda is pretty much primarily going to be just the protocol update. And we hope to get that launched in time for April 1st. That's the goal.
Thank you. Any questions? I understand there is no REMAC report. But check the me. Quality Improvement Committee reports. Is there one?
The QA committee has not met since the last REMSCO meeting. Our next meeting is next week.
Thank you. Stadium has council report. Ruben?
I don't have a
Yeah.
report for you, so.
We'll have a report prepared.
That's good, okay. Other people make slide remarks besides me.
Oh, that's my job when I'm in Albany.
Okay.
I just want to say something. When we were in Albany, the REMSCO and the CMAC approved the New York City protocols to allow paramedics to vaccinate because a vaccination is just another type of medication. And Friday after 5:30, I get an email from Mr. Greenberg saying that, well, they talked about it with their Department of Legal Affairs and they don't think it's really legal, blah, blah, blah. So I had Dr. Schenker involved in it. I called Dr. Lai and a few other physicians that are on our protocol committee. And we are not really accepting that position, and we're going to be going forward with putting these protocols in place because they were approved by REMSCO and
It
CMAC.
appears to me that many decisions, Ryan, are you around? At the REMSCO level, hi Ryan, are being made by legal affairs rather than by the stakeholders. In my opinion, lawyers should only be called in if we get into trouble. Not to make decisions, not to write bylaws, not to do other such things. That's my opinion.
Understand. And, you know, the issue with. You know, and we took back, I think we responded to it as well as Chair Tanker, and, you know, we did bring that back to legal, which they are involved, if they see a legal issue with it. Vaccine, that could also change in time, you know, depending on things changing with, you know, what's in proposed legislation, things like that. You know, the desire to do it and, you know, the benefit of it, I think is there. There also has to be a legal pathway for it to be there as well. And that's the issue there with the vaccine. And if you just go by what REMSCO dealt with that, right, or CMAC, I think it was CMAC, not REMSCO, where they spoke about a protocol, a pilot program for antibiotics. And after probably half an hour discussion, if not more, they determined, well, this isn't an emergency protocol, and therefore we shouldn't vote on it. It's not in our purview to set a protocol based on something that's not related to an emergency. And shortly after, they came up with vaccines, that same discussion kind of came up, but it was felt, we're going to vote on it. The benefit of paramedics being able to do it, I think we showed paramedics, the BMT, the ability for the enterprise to give a vaccine be very beneficial to the community, particularly under an executive order or some emergency. I don't think that market is there. The legality of them being able to is the question. I think even in some senses, and I just spoke with Schenker about, you know, some of these things, situations, especially based on when you use it, is related to should the words, you know, above it say under an executive order, under a time of disaster, to where there's probably many protocols that can be put into place that would be activated at the time of an emergency, based on emergency that occurred. And those opportunities, you know, are there. We've spoken about them in CMAC numerous times, but haven't necessarily seen after protocols that can be turned on and off based on a region, based on something going on. We haven't seen that before. I think it will. I think people are now starting to come out of COVID and actually being like, okay, now we're really, you know, for the most part, out of COVID, start thinking of other things and writing things of that nature. You know, when we reached out to New York City, we reached out to find out, is there something different in New York City law that would allow that? Sometimes there's something that we're not seeing. And that's the part that we reached out to find out. That's the part where, you know, Bree and Joe both responded and gave the, hey, this is our opinion on this. And that's what we passed up and we're working on getting responses. I'll take the call from you. And, you know, working on getting, you know, an official response like the city.
Yeah, I give you a slightly different perspective. You know, among my many hats, okay, I'm the co-chair of the New York City Adult Immunization Coalition, so I'm very interested in vaccine preventable illness. And if I'm thinking EMS, okay, then I'm thinking not just public safety, okay, but the wellness, okay, safety of our EMS workers. Okay, being able to vaccinate, okay, would be a huge advantage in terms of vaccinating our own workforce. Okay, every year, okay, around influenza. Okay, influenza vaccination, okay, rates are extremely poor. Okay, healthcare workers are at high risk, particularly EMS workers, being in the back of an ambulance, okay, which is essentially an enclosed space, okay, without air circulating. Okay, this is something we should really give thought to. Okay, not just the vaccinate EMS workers who work shifts who may find it difficult to get to their doctor or some other location to get a vaccine. There's something we can do for ourselves, but we can even help our healthcare systems. I know my own healthcare system. I work for a very big one. Okay, and we wish that we could use our EMTs, paramedics, I should say, okay, to vaccinate those healthcare workers who work in off-site locations. Okay, where it's difficult otherwise to bring vaccine to them. Okay, so is it a public health emergency? No, but I think it's a public health imperative, okay, that we should think about.
I agree. You're not gonna hear opposition.
Yeah,
because I think-
Go close to the mic.
What?
Go close to the mic.
Yeah.
Trust me, we go through.
Yeah.
And it's mapping.
Yeah. Yeah.
You know, I agree with everything about
Yeah.
that. And, you know, Marie, you spoke, and again, let's look at what comes back from legal on that front. And if there's an obstacle there that's preventing it, let's work to resolve the obstacle. Whether that be from whatever obstacle that is, including legislative changes, things like that. You look at community paramedicine. Community paramedicine didn't make it in the budget. But there were 55 agencies around the state that were passionate about the work that they did should remain. To prove the point of what they were doing was effective, was improving healthcare, was helping communities. And they went through their processes to get a pilot program put into legislation, I think in like the last 3 or 4 weeks of the legislative session.
Yeah.
My point is that if it comes back as an obstacle and it's clearly defined as where that obstacle is, then work to correct that. Maybe you can do a pilot program or something else. But I think that's the opportunity that's there because I agree. And, you know, I've had this conversation with FDNY. FDNY turns and says, well, we have a couple of people on light duty. And wouldn't it be wonderful if they can help health services fill in the blank? The answer is yes. But they legally have to be used.
Yo, Ryan, that's exactly my point. In the past, REMSCO and CMAC approves whatever. And it didn't go to Department of Legal Affairs first. We implemented it. And then if there's an issue, if someone puts up, I mean, everyone has a right to appeal any decision of the CMAC and REMSCO. That's when your Department of Legal Affairs goes into action, and their job is to support the position of the REMSCO and CMAC, not to put up barriers before we even start on a project. And that's where I take exception, and that's what I've been seeing. We need to be allowed to go forward with as few barriers as possible, and then let them help us if somebody on the outside of our industry decides that what we're doing is not what they like. That's just my opinion.
Any other comments? Okay, so that takes care of the REMSCO report.
Yes.
Uh,
Aren't you happy you came?
Unfinished business? Any unfinished business? I'm not aware of any.
Yeah.
Any new business? Marie, did you want to?
Wait, unfinished business is EMS awards. We're voting on them in April. So get your awards in so that we can get them done for our event and then to go up to Albany. New business, we are having elections here for council. We have at-large seats opening up. I'm not sure if the officers are being reelected. I don't think so, but we have a lot of at-large seats. I will give you exactly the number once I go through who's expiring and can't be reappointed. So really think about expiring. I may be expiring. No, I want to enjoy at least a month or two of their retirement. And no, I'm not like Nancy, I'm not coming back. Okay, so elections in June. So think about people that you think really should be on this committee. And I could tell you right now, the fire department 2507 union is going to be submitting a request to us for either getting their own seat or having an at-large seat. And my personal opinion is that it's about time. We should have them on here. Yeah, and they definitely want to be back. And the congestion pricing, I'm gonna be reaching out to Jerry and to Danny Mizell's, poor guy. And if anybody else wants to help with this, we need a primary member that is willing to attend some of these congestion pricing meetings. I don't know if they're all in person or all virtual. We don't have dates yet. I don't know what they're doing. We will make an effort to get you the dates out. And let's get EMS on their agenda.
We have dates.
We do have the dates?
Yeah.
We did send out dates? Okay, okay, so we'll pay more, you didn't get it, Jerry?
Yeah.
Okay. Okay, we'll resend it, but I don't want this to just, die. We need to do something for EMS.
Okay, any new business?
Question on Marie's report. Do we need to select a nominating committee of 3 members from REMSCO?
Yeah, we select a nominating committee, 3 members from REMSCO, 3 members from the board.
Do we have any nominations for that position?
This committee doesn't nominate. You could if you want to. Do you want to be on it?
The bylaws say the 3 members selected by REMSCO.
Okay,
We should
okay,
follow the bylaws.
so go ahead. Do you want to do it this meeting or you want to wait till April?
Wait,
Okay.
Yeah.
No problem.
Any new business? Hearing no new business, again, I want to thank Ryan for coming down and giving us really a very comprehensive
Yeah.
report, very important. Motion to adjourn is in order. Second, we are adjourned.
Thank you, Ryan.
Thank you.
So